Hi everybody, it's Dr. Magnifico from Jarrettsville and Probably.com. So here I am. Here is my dog Fripp. She is about 8 months old. She's a rescue, so I don't really know how old she is. But she has lost all of her baby teeth, and she is about at her adult weight. And then the other thing that I check with dogs is she has a normal positioned vulva. So that's something to talk about with your vet. There has been some studies done about spaying dogs too early and having it affect their ability to urinate normally as they grow older. So I always make sure the vulva is completely developed. I really like to spay them when they're pretty close to their adult weight, which varies based on the breed and the size. That's Jenny barking. She's barking for her mom who just left. I just spayed her. So a spay for me is Rimadyl. They get an injection of Rimadyl about an hour before. I put an IV catheter in. I run IV fluids. So she's on IV fluids, which are right there. She was also on heated fluids. I have a heated surgery table. She got a pre-med. I pre-oxygenated her just because I was a little worried, and then I used Propoflow to intubate and then did a routine spay on her. And she will go home with pain meds. I always do pain meds for about 4 days, a non-steroidal anti-inflammatory. She is just waking up from her spay. Her spay took about probably 30 minutes. I have to admit, I'm always very nervous doing my own dogs, but her spay, if she were a normal client, would probably be about $300 to $400. I really like to put a catheter in. I really like to do the Rimadyl. Sometimes I even do an anti-nausea medication if they are, vomiting or drooling a lot. And sometimes I even give it post-op if they're drooling a lot. And then I stay with her. That's the most important thing, making sure that your surgeon is completely focused and dedicated to taking care of your dog, which is really one of the biggest reasons I worry about the high volume, low cost spay and neuter clinics. It's just really hard to do high volume. So I took the whole day off to do my dog so I wouldn't have to worry and I could dedicate all of my time and attention to her. And now I'm just watching her wake up, which in my opinion is one of the most critical periods. We do a really good job of watching and monitoring them while they're under anesthesia. And then it's really important to monitor them for the 20 minutes to 30 minutes after. So that you make sure their heart rate is nice and steady, they're breathing really well, and I keep them on the tube for as long as I need to. So that is my dog spay video. Talk to your vet about all of those things, about analgesics, about intubation, about what kind of induction agent they use. Ask them to write it down, ask them to give you an estimate, ask them about post-op stuff, including what you can do the day after or that night if you have any questions, because that's a super important period. Ask about an e-collar, which I do on typically any of the older dogs. I have an e-collar at home, so I'll have that ready for her. And then if you have any questions or concerns, get a second opinion. If cost is a big issue, then use one of the high volume clinics. I would rather have dogs spayed than not, but you need to understand what the difference in the procedures are and why the cost difference exists. If you have any questions about spaying or anything else pet related, you can find me here at Jarrettsville Vet, or you can ask a question on Probably.com. Take care, everybody. Say good morning. Good morning, Frippers. Bye.